Welcome to the podcast, The Patient's Voice. Does it matter? This is a place where your voice will always matter to me. Healthcare is complicated, so I wanted to create a safe space where we can discuss tips, hot topics. I can provide you with resources, have guest speakers who are experts in the healthcare industry, or real patients that are sharing their patient experience in hopes to help you navigate any healthcare setting. I want to focus on you, the patient, and discuss issues that matter to you in an open and transparent way. I'm your host, Krista Hughes, the founder and CEO of Hughes Advocacy, in which I am a board certified patient advocate. I have a passion for patients. Let's be the change together. So, welcome back, friends. In today's episodes, we're going to talk about skilled nursing facilities. And you're going to hear them a lot called, we'll reference them in this podcast, but you'll hear it in the healthcare. Everybody does acronyms. So you'll hear it as a SNF, and it's SNF for skilled nursing facility. So that's what we're going to talk about today. So if I say SNF, you will know what I'm talking about. So as always, I will start the show with a what would you do segment. Then we're going to transition into let's talk about it. And finally, wrap up the show where I will provide you tips and how to make your voice matter in this situation. So let's get started. A client in their 60s reached out to me for assistance with a family member who had Alzheimer's. Okay, the client was in need of assistance of being placed into a memory care unit. The family member was currently at a skilled nursing facility or a SNF. So during the call, I asked the client about the plan of care the patient was getting, therapy they were getting, and the requirements that were needed to qualify for memory care. The client was not aware of the plan of care, but did know that the patient was getting speech therapy, occupational therapy, and physical therapy. After asking questions, I then learned that the patient had a wound on the bottom of their foot. Would you know what to do next? Okay, let's talk about it. So first, let's talk about what is a skilled nursing facility, a SNF. So per the CMS website, and that's Medicaid, Medicare, and all this will be attached in the show notes. A skilled care is nursing and it's therapy care that can only be safely and effectively performed by or under the supervision of professionals or technical personnel. It's healthcare given when you need skilled nursing or skilled therapy to treat, manage, and observe your condition and evaluate your care. Medicare covered services in a SNF include, but are not limited to. So when you get these services, whether it's been after a stroke or after, you've been in a wreck, you have broken bones or anything, sometimes after cancer or brain tumor, anything where you have to go and get speech therapy, physical therapy, or occupational therapy, that you are usually sent to a SNF. And some of the things that are covered are you usually get a semi-private room. You might get a private room. Your meals are paid for. You'll get that skilled nursing care, physical therapy, if that's what's needed, occupational therapy or speech therapy, all that if that's needed to help you meet your health goal. They'll have social services. They give you your medications. They have medical supplies and equipments that are used in the facility. They have ambulance transportation to the nearest hospital if you need to go. We'll talk about that in a minute, why you might need to leave a SNF to have an ambulance ride. And they have dietary counseling. So that's what's covered when you go to a SNF. Now, additional tidbits to know. You may get skilled nursing to improve or maintain your condition or to prevent or delay it from getting worse. Now, Medicare, Medicaid only covers 21 days of therapy. If you need more days after the 21, you have some options. If you need more therapy, you can pay out of pocket. If you need to stay longer, you can stay in a skilled after your 21 days are up until day 100. But again, it's a copay out of pocket expense to you. Now, if you disagree with your discharge date at the 21 day mark for any reason, you have the right to appeal that decision to discharge you. And most people don't know you can do this. You always need to file for an appeal. I do this all the time for my clients. 98, 99% of the time I have filed an appeal, we have gotten an extension. I always do 2 appeals. You're allowed to do, I think, up to 3. Don't quote me on that, but I know you can do 2. And sometimes the second appeal, we win. And what that means is your time is extended. So you might even get a whole nother week or up to 10 days for extended nursing care. But now you always need to do your homework. When you find out that your loved one needs to go to a SNF, you need to do your homework and research each and every facility. And how you do this is it's available at the CMS, which is Medicaid, Medicare, Hospital Compare website. And all that's attached in the show notes. And what it does is when you go to these facilities, you can compare all the facilities in your area. It shows deficiency reports, which I teach about on my YouTube channel on how to read deficiency reports and understanding those reports. And what these reports do is they show what the facility has actually done to harm a patient. The complaints that are in here for the deficiency are usually made by patients, caregivers, family members, or advocate. And it also shows their quality ratings. And the reason I think you should always look at these deficiency reports or compare, it'll tell stuff like how many nurses, the ratio of nurses to patients. Don't just Google this information. I can't tell you how many people, clients that I Googled and they had great star reviews. And it's like, well, did you read their quality reports and their deficiency reports on the CMS website? Because SNF, skilled nursing facilities, are where I and clients across the country are having the hardest time with the poorest quality of care because there's no accountability at all at these facilities. And it is an awful problem. So please do your homework on this or reach out to an advocate. This is the one area in healthcare I will tell you, please don't do this one alone. So what are quality ratings? They're ratings and they're measured by Medicaid, Medicare, CMS. And these facilities are supposed to follow these guidelines. Like I said, supposed to. That's what's so sad is you have to keep them accountable. And the ratings, when I go in there to look at the quality ratings to use when I'm researching, are things like, I want to know how many times has the client or patient been hospitalized and readmitted. And what that means, we were talking about they provide ambulance rides. I mentioned that earlier. What that means is they've gotten some kind of infection, and I'll talk about that in a minute, that the facility's not taking care of them and they have to go to the hospital. And if a nursing home has to send a resident back to the hospital, it may be because the nursing homes or the SNFs are not assessing or taking care of their residents well. Y'all, this happens all the time with my clients, and it's due to negligence. So do your homework. Look at these quality ratings. Another quality rating to look at are ulcer wound ratings. This is so common. Remember, the example we're talking about today is there was a wound on the bottom of his foot. That means they are not moving you. When you are in a bed, and especially if you can't get out of the bed, there are criteria that you are supposed to be rotated every, I think it's 2 to 3 hours, so you don't get an ulcer or a wound. Because if you do, it can prevent you from leaving, because that's an open infection. So this can lead to infection and sepsis. So look at these ulcer and wound quality ratings. Also, don't you want to know they're in a rehab facility to get better? The quality ratings will tell if these facilities have improved patients' therapy stay. You have to stay on top of this one. You have to be involved. You have to know your patient's baseline when they get in there. And you need to know, are they improving? It is your job, I hate to say it, to ensure that they are meeting your goals for when they go home. For example, I had a client that was doing therapy, occupational therapy, to go to the bathroom. And I told the family, make sure you let them know the setup of your bathroom and how difficult it is going to be for this patient, so that they could simulate at therapy what it would be like for this patient, so that he would be successful in going to his own bathroom for therapy. So you want to be involved with the treatment plans, with making sure they're doing the therapy they're supposed to. But again, these are in the quality ratings. You also want to know, are they a good facility with the ability to get your patients out of there? And were they successful from their treatments? That is the main thing. Don't you want them to go home and have appropriate care? So you've got to be a part of the team. And then, of course, the biggie that you always talk about with any healthcare settings are infection rates. Always, always with women, there's always an issue with UTI, untreated UTIs that leads to a hospital visit, which puts your loved one back in the hospital. And if the UTI is really bad, or the UTI turned to sepsis, they take 10 steps backwards from all this therapy they've been getting, because now they're back in the hospital, back weak, immune system's compromised. They're having to get all these IV meds. They're not getting the physical therapy. And those 21 days, so say you'd been at the SNF for 10 days and you get into UTI, you have to go to the hospital. When you come back, you only get those 11 days. You don't get, the clock doesn't start over. So please make sure you go through these quality ratings and everything, because you're wanting to get the most out of these 21 days, because when they're over, they're over. You have to be involved. And again, all of these resources that I'm mentioning are included in the show notes. And the last thing I'm going to talk about before I finish the moral of the story and what you should do, I want you to know your rights. I can't tell you how many times they lie to you about what your rights are, and you have to just throw it back in their face. But you can familiarize yourself with, you need to know these rights staying in a SNF. The two biggest lies that I hear are the following, and they make me so mad. Now, there's many, like I said, please go read all of your rights, but the two that are violated are your medical care right. I'm going to read it. You have the right to be informed about your medical condition, your medications, and to see your own doctor. You also have the right to refuse medications and treatments, but this could be harmful to your health. You have the right to take part in developing your care plan. You have the right to look at your medical records and reports when you ask. Where I'm being lied to is they're not making you part of the plan of care. Remember the story we're talking about? This patient had no idea what I meant about, were you part of the plan of care? Do you know the treatment plan? Make yourself, it is your right. You need to be in all those meetings. You need to be part of the treatment plan. You have a voice, just like I said, the client that's with using his bathroom had constraints in it. That's why you've got to be part of it, because your job is to be make your loved one successful. Be part of this care plan. Do not let them tell you that you are not allowed. And of course, you are allowed to have your own medical records. They love to say, we'll give them to you at discharge. No, if you want a copy every 45 minutes, you get a copy every 45 minutes. The other is your family and friend rights. Family members and legal guardians they are allowed to meet with you. Sometimes they'll say, we won't meet with an advocate, or we won't meet, if your cousin is who you want them to meet with, they'll tell you, no, you have the right that they can participate in anything, because family and friends can help you make sure you get good quality of care. By law, a SNF must develop a plan of care or a care plan for each resident. You have the right to take part in this process, and family members can help with your care plan with your permission. If your relative is your legal guardian, he or she has the right to look at all your medical records about you. He or she also has the right to make important decisions on your behalf. Back again, please familiarize yourself with this. They will lie to you, tell you these aren't your rights. They will keep you out of it. They will try, they don't make it patient-centered. Some of them are lazy. They don't want to do anything. And I hate to be cruel like this, but my job is to be honest and tell you what's really going on. I had a client that went 10 days without a bath. You have got to stay on top of a skilled nursing facility. And as of right now, there's no transparency or accountability. So it's your job to hold them accountable and fight for your loved ones. Okay, now that we've gotten all out of all the what you need to know, let's make your voice matter. So back to the story at the beginning. Wound care, if you have a wound, it can prevent a patient from getting into a memory care or going into a nursing home or assisted living. So that is a big deal, especially if you're being kicked out because you've met your 21 days, but the facility has not addressed your wound. And because of your wound, which is an infection, now you have nowhere to go. It's a big, 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 big deal. And it can cause you to get sepsis. So this client had a wound and we weren't getting any answers. So I reached out to the director of therapy at the SNF to find out more details regarding the therapy this patient was getting. Now remember, we're to be part of the team and know everything that's going on with your loved one. Also, I wanted them to know that he would be going to a memory care. He has Alzheimer's after discharge and what those expectations were to qualify. So the therapist agreed, added all of this to the plan of care, and worked diligently to meet those requirements. That's how it's supposed to be. The biggest issue remaining was the wound. So the therapy, perfect, worked like a well-oiled machine. Wound care, we couldn't get in touch with them. The family member emailed them, asked if they would reach out to me. A verbal was given. I called several times trying to get in touch. Wound care refused to contact me, refused to contact the wife. The nurse manager, the director of therapy emailed and verbally asked wound care to reach out. 10 days later, no one heard from wound care. So the wife, she was there every day, noticed that they weren't changing the bandage on the foot because they dated. So we took pictures for documentation. Days went by without this being addressed. Now I'm gonna stop right here. This is what makes me mad. There's no accountability. I mean, yes, we can demand this and know our rights, but right now there's no accountability and not much you can do except continuing to get in their face and demand it. So there were dates. So we noticed the wife was sending me pictures and it was getting worse and there was blood now in the patient's bed. The bandage had to be removed and no one came to rebandage it for at least a day. So now the discharge, the 21 days from the SNF, was quickly approaching. And when you're going to either a memory care, an assisted living, or a nursing home or long-term, before they'll accept you, they have to come in and do an evaluation of you. And it's their discretion to take you. So if they come in and notice a wound, that's an automatic denial. That's why it's so important. So memory care was coming in to do an evaluation to see if this patient would qualify for the facility, and the patient failed due to the wound. That's why this whole podcast episode is so important. You've got to know everything about a SNF. You got to know your medical rights. You got to know the quality of care. You got to know you've got to fight, because people don't realize you have 21 days. And when this stuff happens, what do you do? Literally, what do you do? And I hope this is going to help educate that if you don't know what to do, at least if anything, call out an advocate. So they failed the evaluation, and wound care continued to refuse to reach out to the wife, the daughter-in-law, or me as the advocate. So while the family one day was on site, the wound care, they tried to go up and refused. So the day before this patient was about to be discharged, I reached out to the director of nursing to discuss the wound care issue and our next steps. Now, being an advocate, I do know how to write up particular people. You can write them up with the state, with the nursing state Department of Nursing. You can write it up at the federal level, which we did. There are policies in place to write them up. Just, I'll say, things are changing for patients for when you write them up. Penalties, I hope, are coming in the future. But as of right now, all you can do, but we were talking about the deficiency reports earlier. If you do write up a nurse or a facility for doing something like that, it goes into the deficiency report. Now, nothing might not get done, but the State Department does go in and they do an evaluation, and that's how we get these deficiency reports. So if any of this ever goes on with you and a family member, please write it up, because it will be captured for other family members to see in a deficiency report. And hopefully, if it's the same person doing it over and over again, they lose their license or lose their job. So back to the story, I digress. The director reported that the social worker should have discussed this with the patient family, and they were about to discharge him, and that he should have received a 3-day notice. I'm telling you, this is what they do. They just start kicking you out and all this technicality. They don't treat you right, but when they're ready to kick you out, they all of a sudden follow the law and the rules. And so sent this 3-day notice, and that's a formality when you're leaving. And they apologized and stated that that he would have to be discharged the next day. And the family had to find where he was going to go. It's like, what do you mean, where's he going to go? Literally, by law, they can't kick you out. You just might have to pay out of pocket. So anyway, so this family was discharged with no placement to go, and you can't do this. Because then you're stuck paying a bill. Like, I think it's some places it's $200, $300 a day. So this is wrong and needs to be changed. Complaints need to be made at the local, state, and federal levels. This, it makes me just so mad that this is going on to your loved ones. I know what to do. I know how to fight, and I will fight. I get so tired of being lied to. They're breaking the laws, the regulations, the requirements medicated by Medicare, Medicare. Please stand up. Please make complaints at the local, state, federal level. Please know everything you need to know about a SNF. Know your rights. Know how to do complaints. Know how to look them up on the website. Know everything you need to know about your 21 days. Make sure you're always there with your loved ones. Please use your voice, and don't let this happen to you. They do what they want because there is no accountability. Thank you. I hope this made sense. I'm sorry for the rant. This makes me so angry that it happens to you as a patient. And my job in these podcasts are hopefully to give you a voice so that you can understand healthcare better. Again, make sure you check out the resources in the show notes, and I hope you have a fantastic day, because this brings us to the end of the episode. I do. I hope this was beneficial to you. And as always, thank you for listening to the patient's voice. Does it matter? If you enjoyed the show, please make sure you follow, rate, review me on all the outlets, on YouTube. And until next time, this is Krista Hughes. And remember, I have a passion for patients. Let's be the change together.